I'm even curious about how the Cambie Clinic operates, because you said that you work under workman's compensation, where there's employers that come together and they demand a certain level of performance, a timeliness, a
Yes.
quality of outcome, because they want their employees to get back on the job so they can live their lives and be productive again. So isn't that kind of a mini example of how we need more Cambie clinics, not less?
Yes, I mean the point is, and this sounds like a paradox. It's actually cheaper for a government to treat people more quickly than to let them languish on wait lists, because we know
Yes.
medically that if people wait, they get more complications, they're more complex, they get dependent on drugs, on sometimes on narcotics if they're in pain, and the Workers' Compensation Board has recognized that. They actually save money. And when I was CMA president, we did a study that showed across just four provinces and just four or five procedures, that the savings, the cost to the economy of not treating people in a timely manner was almost $15 billion. That's just for four or five procedures. Imagine what that say. That's because no one is looking at the economic cost of keeping people off wait lists. The only time it saves money for a government to to keep patients on a wait list is if they die on the wait list, which
Oh,
is a
it's
tragic
horrible.
a tragic statement to make.
It really is. And you know what? It's really quite tragic how our healthcare system then is, while it's helping so many people, is really hurting a lot of people. So I think we all know stories, anecdotal stories of this happening. In fact, I think of a friend of mine, his name was Mark, who, interestingly enough, was on the other side of the country, and he had a very painful condition. And it was so painful he could barely sleep. And this chronic pain is debilitating, and he could not work. And he found out from a specialist that there was a solution, but he'd be on a 2-year waiting list. But he said by the time he would have that remedied 2 years from now, it would not be solvable. So he actually ended up being recommended to your clinic. And I haven't told you this, but my friend went to your clinic and he said it was the best service he's ever had. And literally within 3 weeks, he came out of that clinic a new person. So it's really a remarkable story. And that's what you do every day, isn't it, Dr. Day?
Yes, I mean, one of the paradoxes also is once you cross a provincial border, you're considered a foreigner. So if you go to another province, you have rights in that province that the residents have are denied by law. And I use the story. Imagine if someone from Ontario, if someone from BC went to Manitoba or went to Ontario and was allowed to go through red traffic lights and drive at 80 kilometers in the 30 miles, 80 kilometers in a 50-kilometer zone, how silly that would be. But that's what we do in healthcare. And of course, it's not a solution to build a wall and stop people traveling. What the solution is to open up the system and make it like the European and New Zealand systems, where there's a little bit of competition. I had a German fellow visiting, an orthopedic surgeon just left. He was from Germany, and kind of I knew the answer to the question, but I said to him, if you're in pain with a hip or knee replacement in Germany, you have a public system and a private system. 90% of the public is 90% of the system is public, 10% private. He says, "Oh, the long wait lists in the public system compared to the private system." I said, "Well, how long would you wait for a hip or knee replacement in the public system?" "Oh, a long time." I said, "How long?" "Oh, maybe 6 or 7 weeks." I said,
Isn't
"Oh,"
that incredible? Wow.
and he said, "Well, in the private system, you get it done within a couple of weeks." So it just shows you that introducing competition makes to a monopoly, forces the monopoly to perform,
I agree.
because in Canada the public is denied any competition, and so we don't know any different. We think
I
a
agree.
year or two for a hip replacement is normal. It's not.
Yeah.
We are in a country where the state effectively believes it owns your body and has control over your body, and it's up to them when you need care. It's up to them as to when and if you get that care, and that's unacceptable in my view.
Oh, I share your disappointment and anger, Dr. Day. I mean, this begs serious questions about our institutions, how out of touch they are with the reality of the lives of Canadians and their suffering. This is not just simply a policy issue, it is truly a moral issue as we have people dying on waiting lists after waiting lists. And it says to me that the narrative, the discussion in the public square has been taken over by special interest groups that have narrowed the discussion of what is deemed to be acceptable so that we don't even pay attention to the facts and evidence here and how this is hurting people.
Yeah, and those special interest groups are hypocrites. There's a group called the Canadian Doctors for Medicare, and there were other groups who intervened against us in our trial. They were holding protests outside our clinic. Representatives were being interviewed. Those representatives being interviewed had been to our clinic and had private surgery and paid for it themselves.
Oh, for Pete's sake. So this is, again, another revelation where it says who is serving whom here. That we can't kind of set the record straight here in terms of what's happening in our country in healthcare and grab a hold of this so that we can redesign this system, like in Sweden, for example, to actually really improve this system so it serves the people. It's really a defining issue for our country, is it not, Dr. Day?
Yes, and again, it comes down to who owns your body. Does the state own your body, or do you own it? And if you are suffering with an illness, whether it's a minor illness or a serious illness, and the state is not providing the care that they promised they would give you, they cannot possibly force you to just wait and suffer, which is what they're doing in Canada. And
Crazy.
to reiterate, it's the only country on the planet that exerts such power over your body.
So it's 2024, Dr. Brian Day. So you have been watching this unfold for a number of years now. Where are we at in 2024, and how is this going to unfold next? Like it seems like it's going from bad to worse. What point will people wake up and realize that this is totally unacceptable?
Well, it's imploding, right? The health system is imploding. And so there's a limit. Even nice Canadians who accept their government control in many areas of their life, once it affects them or their loved ones, things change, people change. And it's all well and good to have a universal health system that promises access when you're not ill. I think it has to change because the status quo is just not possible.
Indeed. And we can learn from other countries. So let's have the money follow the patient. Let's put in those service guarantees, and let's create flexibility around who are the providers so we actually have competition rather than public monopoly. So if we look to the horizon here, what can we do as citizens? Because it is truly, I hear a lot of frustration from people, fellow Canadians really across the country, saying they can't get health care, they can't find a physician. What can we do to change this mess?
Well, I think you're helping change that by educating the public, because I don't think many Canadians realize some of that our hospitals are funded the way they are, that they are cost items. I don't think many Canadians realize we're the only country on the planet where private access to care is illegal. I don't think they understand that Canada is out on a limb here, and that that it has to change.
Indeed. Well, I like the way you think about this very important policy issue. It matters to all Canadians, Dr. Brian Day, as you know so well. So I want to thank you on behalf of all of us for your pioneering work, not only as a physician, but your pioneering voice of courage and leadership in this very important area. So thank you for joining us for this conversation today.
Thanks, David.
Without open discussion and debate, you're not thinking, nor are you free. Comment below. We'd love for you to join the conversation.